Hudson, and I'm here to do an assignment for Abnormal Psychology 14. I'm going to share some information with you about dissociative identity disorder. Associative identity disorder is commonly known as by its acronym DID or DID. Associative identity disorder used to be formerly known as multiple personality disorder up until around 1995. And then they decided to change the name to dissociative identity disorder, which really kind of goes towards the true nature of the condition. Associative identity disorder is frequently amongst people who have experienced some traumatic event in their life. Uh, they usually are victims of some severe abuse that has occurred in their life. So defining associative identity disorder is a severe condition in which two or more distinct entities or personality states are present in and alternatingly taking control over an individual. Some people describe this as experiencing possession. Um, the person also experiences memory loss that is too extensive to explain by any ordinary forgetfulness. So it's kind of a blank slate that is like apparent. Um, this disorder also is characterized by by identity fragmentation or splitting, rather than the proliferation of separate personalities. So it's really the same person, just different parts of them split up to make it its own entity. So the diagnostic criteria that the DMS-5 uses for diagnosing dissociative identity disorder, mainly, first of all, has to be a disruption in identity characteristics by two or more distinct personality states. Also, the recurring gaps that recall everyday events, important information, and traumatic events. Thirdly, the distress or importance on social matters and social dysfunction, as well as work and vocational dysfunction, and all in those areas showing the distress. Then there's the disturbance. It's not a normal part of a broadly accepted cultural or religious practice, so it's not something that's ordinary, something that's not normally accepted. And finally, these symptoms cannot be caused by any kind of substance use disorder or medical condition that may cause these symptoms. Those are all ruled out. So the prevalency of, surprisingly, of multiple personality disorder or dissociative, dissociative identity disorder is 1.6% of all adults. And yet that breaks down to 1.5 of males in gender wise, and not too far below 1.4 in females. Some of the differential diagnoses that are associated with dissociative identity disorder is major depression disorder, bipolar disorder, post-traumatic stress disorder, psychotic disorders, substance and medication induced disorder, personality disorder, and conversion disorder, seizure disorder, fictitious disorder, and malingering. So we get to treatment. Treatment for dissociative identity disorder is primarily psychotherapy, with some exposure therapy under that umbrella to explore the traumatic event and bring it to the foresight. So by exposing the other entities, it helps in bringing those entities together, because that is the major purpose of the therapist, is to try to reunite all those entities into one personality. And they usually use some other cognitive behavioral therapy methods to do that as well. They use hypnosis as well to really bring out those personalities that are within. Key component that the therapist will probably use in the treatment is suggesting that they get some kind of support, some kind of self help. Um, there's a whole lot of different support agencies out there, I mean, support groups with people who are suffering from dissociative identity disorder. And when they come together, that usually is the empathy and the conversation usually is great support in the treatment of this disorder, as well as there's a growing online community as well. Medications, unfortunately, are not as effective for this disorder as medications have been for a lot of other disorders. Uh, Primarily because in order for someone who suffers from dissociative identity disorder to be medicated, they would have to be under severe watch by their psychiatrists and caretakers, uh, because of the possibility for abuse and ultimately death. So just as a recap, the first thing is, first and foremost, that you need to get a correct diagnosis for associative identity disorder. Rule out all the differential diagnoses, and get tested, see doctors, see physicians, make sure that it does meet the criteria of the DMS-5. Once you know that, get informed about this the disorder. There's a lot of information out there, a lot of books, a lot of movies, a lot of case studies, a lot of things that you can read currently on dissociative identity disorder that will put you in put the put the patient into a more knowledgeable situation of his disorder, and definitely get into treatment with a psychotherapist, a psychologist, or a psychiatrist. Uh, you need that, and they have to be primarily a professional that is trained specifically in that field as well, because it is a little more technical, and you need some advanced training in order to bring those identities together and work over a long period of time to bring that person back to one. And finally, get some support. There are lots, like I said, there's a lot of support groups out there, a lot of agencies, a lot of nonprofits, a lot of different umbrellas in which you can fall in under to make sure that you are doing the maintenance that is needed to overcome this disorder. Well, my name is Ron. This is Dissociative Identity Disorder. I hope this information has been useful for you. I hope you have a broader understanding of this disorder, and thank you for listening.